and welcome to the second season of the AUA Focus Series, a podcast channeled by the AUA Media Lab. I'm Varduhi Petrosyan, the Dean of the Turpanjian College of Health Sciences at the American University of Armenia, and I'm very happy to introduce our guest, who is the first Deputy Minister of Health, Dr. Lena Nanushyan. She is our graduate from the MPH program 2005. Welcome, Dr. Nanushyan. We would like to discuss today a very important and historical health reform, which is related to universal health coverage for the Armenian population. I would like to ask you, what is the history? How did you come up, how the Ministry of Health came up with the idea of offering universal health coverage to our population, and what would be the policy objectives?
First of all, I wanted to thank for the invitation. It's always honor for me to come back to my alma mater and also talk about this very important for our country and for our nation, very important project, which is about the universal health coverage. Well, historically, I remember in the beginning of 90s, when Armenia gets independence, we have been working hardly on the implementation of insurance system, and many countries that after Soviet period already introduced, but unfortunately, during these 30 years, we were not able, because of different factors, because we were not ready, because there were many challenges, we were not ready to implement. But I remember each year there were discussions within the government, outside of government, that this is the important reform that should be implemented. And this is not only the thing that, many implemented, and that means that we also have to implement, but the issue comes from the field studies that shows that the out-of-pocket payments are very high in Armenia, and people are paying from their pockets for health services, for drugs, mainly for drugs, and each year we get more and more out-of-pocket payments. And this, of course, has a devastating effect on their families, and people are getting into the poverty because of these, inaccessible health services. And unfortunately, we're might be the first highest, in the country, in the world, that has highest out-of-pocket payment. And this also affect on different regulations because we do not have, this regulation, this prepayment system. People were not only unable to access the services, but they were delaying, postponing the healthcare services. And when it is already too late, they were coming back to healthcare facility, and already government took their expenses, but it is getting already very high. And we cannot also regulate many things like the prices of drugs, like the regulation that first the primary healthcare doctor should see, etc., etc. So that there are many regulations that are connected with the UHC reform, and currently, while we will be implementing this reform, we will be able also to regulate other things like prices of drugs, like that protocols should be implemented, and oversight of protocols, etc., etc. So this is very important reform. And we think that in coming years, we will see the improvement of health status of our population. Of course, currently we already observe, because last several years there were, for example, this year we had twice more health budget than in 2018. So the budget has increased. People are getting more services, many new programs opened for them, but still the problem of out-of-pocket payments still remains. And we do hope that in coming years, not in terms of out-of-pocket payments, but also health status will be improved of our people.
Yeah, you're very right. The data demonstrates that over 80% of total healthcare expenditures are coming out of pocket, which means it's a huge financial burden on our families. And I'm happy to hear that through this program, we can improve access to care and protect our people from financial risk as a result of getting sick. So thank you for answering that question. When do you think this reform will be implemented? I know there is a suggestion that in the beginning of 2026, but I would like to know when exactly and what will be the steps. Thank you.
So the design of the reform is done that each year we will implement some part of the reform agenda. From starting January 1st, 2026, we will start with vulnerable groups and also with some partial involvement of working population. So vulnerable population, here I want to mention, so I'm passing already to other questions, but this is a gradual implementation. So we think that we need health system also be ready for such reform. So first year, the vulnerable population will include children, disabled people, poor people. So these are groups who are already in the state order package. They're receiving last several years the health state budget. They will remain. And for them, the package will be becoming more larger and more universal and comprehensive than it is currently. But there is also one big group that will be added to in 2026, which is the elderly, 65 and plus population. This is the most vulnerable people who have been denied for free healthcare services last several years. And because they sometimes, are not able to access health service financially because the pensions are low and they cannot access. So we have been observing many health, challenges among this population. They were not accessing their drugs for chronic diseases because it was not paid, and of course this affects on health status. And next years, in 2027, the other part of working population will be already involved, and then in 2028, the remaining population, people working in agriculture field, the students, and all those who were not included in the first 2 years. So this is the gradual implementation, which will allow us to be more flexible, not only to get prepared for the large reform, but also during the implementation, find out the problems and be flexible and make solutions for each problem that will be identified.
Thank you. Dr. Nanushyan, could you describe the package of services briefly?
So we have analyzed the all those cases that we have registered in hospitals and at the primary healthcare level that people are usually applying for. And this analysis show that what are those burden diseases that usually people are applying for. Then we analyze what type of services can be implemented in the primary healthcare level that will allow to somehow prevent those diseases and implications. And so, of course, added screening projects, added drugs that people can receive at the primary healthcare level. And so this is the package that currently we have. So mainly the primary healthcare services, drugs provided at the primary healthcare services, screening projects, and the hospital level, those services that, are burden for our population. Of course, not everything will be covered. There will be also some co-payment for example, the drugs for oncological diseases at the hospital level will be covered within 1.2 million Armenian drams per year, and other parts will be covered by people themselves from out of pocket payment, or if they have a voluntary additional plus package, it will be covered within those packages as well.
Mm-hmm. You mentioned that the reform will be done step by step, increasing the number of people who have coverage. Do you think the package of services will also improve over time?
That each year, in June, health minister will analyze all the data and discuss within the government possibilities for further enlargement of package or groups of population. For example, if the analysis will show that there is a need to cover all, drugs for oncological diseases, or there is a need to implement new approach for treatment of oncological disease, for example. And if there will be available financial fiscal space, and this will be discussed with Ministry of Finance, then there will be opportunity for us to go to the law and change the law and include some type of services or some type of groups that were excluded from the reform. That this is a chance for us that each year we have to revise the program, analyze the data, and come up with the suggestion to the government and parliament.
Yeah, it's a great idea to have the continuous monitoring system and learn what is working well, what is not working, and make changes in the laws and regulations. You mentioned financial aspects of the program. Before going to my next question, I would like to mention about a recent study this summer with support from World Bank and, of course, in collaboration with the Ministry of Health. We implemented a nationwide survey where we had over 1,150 participants. One of the questions was about what challenges do you envision that this program could have? And they were concerned about how much they would contribute to implementing this system. So what would be their contribution and how could we address those concerns?
So I want to use this opportunity to thank you for the involvement in this project. You have been not only with this study, but starting 3-4 years ago, you have been also contributing in different aspects for this reform. And this is also very important to know how people are feeling about the reform, what they find as a challenge, because the communication is key. And if we will not communicate properly the information to our population, we might have much more difficulties, and out-of-pocket payment might not, decrease. So, for people, for those groups that I have mentioned, for children, disabled, for poor, and 65 plus, these groups will be financed by government. And this is a huge step, as I have said, especially for elderly people. So, for other groups, for in 2026, the working population who receive 200,000 and above salary per month, they will be involved in the first stage of the reform. But there was a decision in the government led by the Prime Minister that we need to find ways to decrease this financial burden for our people. And first, there will be a change in ZINAPA premiums. You know that each month we pay to ZINAPA from our salaries. Yes. It will be decreased, and free already money from this ZINAPA will be directed to insurance. But also, there was a decision that for people who receive 200,000 to 500,000 in this range of salary, the insurance premium will be 4,800 Armenian drams per month, and other part will be subsidized by the government. This is also a huge step for the implementation. First stage, government is taking the burden of this, premium stuff. The monthly premium is set up as 10,800 drams per month. This is about $25 USD dollar, but even these premiums will be subsidized for people who receive less salary, but also who receive up to 500,000. the changes in ZINAPA regulation will allow them to pay from ZINAPA, not to pay to ZINAPA that much, but direct this money to their health insurance.
Do you expect any other challenges during the implementation of this very rigorous and complicated program?
I think there should be challenges, or they must be challenges, because when you are drafting a law, when you are designing a reform, it should come into life, it should be implemented, and you only after implementation, after first days of the start of the reform, you will see what are those issues, and the issues will be there. And at this point, even we expect that there might be problems with, waiting lists. There might be problems that the primary healthcare might not be able to accept all those patients that will apply to primary healthcare. The skills and knowledges of primary healthcare should be continuously improved. But I wanted to talk about the communication. You have mentioned already that this is also important and challenging, that if people are not aware how to apply, what are their rights, what type of package they can receive. Of course, this can be a huge challenge, and I know that you have been working, and I would be also happy to hear what shows your research on that issues.
Yeah, as I mentioned, one of the potential challenges that people wanted to understand was their contribution. And thank you very much for answering that question. And I know there is current campaign to clarify those questions for our population. There have been a smaller group of people who were not sure if the Ministry of Health could handle, because this is a big reform. And during the very first months, it's time to show what the ministry is capable of doing. But you are right that we need to build right expectations, because if people think that everything is going to go very smoothly, it's not realistic, because it's big and complicated. But what is more important, as you mentioned, to have the capacity to monitor, identify an issue, and address the issue immediately. But it's good to also mention that majority of our population mentioned as advantages of this program the same that you mentioned as your goals. They were hoping that the program will improve access to medically needed care, and they were very much hoping that it will help to reduce out-of-pocket expenditures. So here we have, coordination, or your goals are in line with the desires of our population. So I'm really happy to see that. And here I want to emphasize that when we have done the survey, of course we have a sample, but what we have demonstrated that the sample was very representative of the population of Armenia. We compared our data with the census data. For example, the age distribution, gender distribution, socioeconomic distribution, even educational level distribution was very similar to the population levels, suggesting that the survey results are very much representative of the Armenian population's opinions. So that's why it gives data to you and partners to address the communication issues. Yes, raising awareness was also one of the challenges mentioned, because there were people who knew, particularly older age citizens who need healthcare more. They knew more about this reform. People who had higher education also knew better about the reforms than the other groups. But I think through the awareness raising campaign, you can address the current gaps in the awareness level, so that people are on board. They know about their rights, and they know how to use the system, how to approach the system, and how to use the services that you are going to provide. And one more thing I would like to emphasize, we have done 2 big surveys. In 2020,
The
we
willingness
asked,
of
yes, we
payment.
asked people if there was such a program, what would be the level of support? And then we had around 73% of people interested in this program and were willing to contribute from 2 to 6% of their income towards implementing such a project. And when we asked a similar question this summer, whether they would be supportive of such reform, and I'm happy to mention that about 83% of the population were very supportive or supportive of such reforms. So over the last 5 years, people learned a bit more about this potential reform, and the support for the reform increased among the general public.
I remember that your study in 2020 also was a factor for us that we can go for that reform because people were open for such reform and they are willing to pay for the reform. Now we are thinking how to decrease the financial burden on them. But in any case, I think this is a momentum for this historical reform that we have been talking for many years. But now not only government is ready and open and willing to implement such reform, but people also are waiting for that reform. It is expected reform. But while we are leading this communication, you know that we are working with different mass media through social media, but it would be interesting also to hear what are those sources that have been found by your research as most effective to communicate the messages we are now having.
Our findings have suggested that TV remains a major source of trusted source of information, and this is particularly true for older age citizens and people who live outside of Yerevan. For people who live in Yerevan and for younger generation, social media remains a trusted source for them. What is interesting, we also found that our doctors, particularly primary care doctors, remain one of the most trusted sources to learn about such reforms.
In Yerevan or in Marsis as well?
Both. Actually, in Marsis, we found that primary care physicians had more trust than in Yerevan, and the relationship between providers and the population are closer. So they really have an important role to play in this reform, communicating about the reform details to the population, and it's expected by the people that this is going to happen. So it is very, very important for the Ministry of Health to also work with provider communities, both physicians and nurses, because very often nurses communicate closely with the patients, and they could also serve as a trusted channel to pass information to the population.
Yeah. What I want also to mention that last several years we have been Ministry of Health and the government have been working to improve conditions of working, places in primary health care and also hospitals. And across Armenia there were numerous renovations. We are building new hospitals, and now we are switching to building, renovating of primary health care, because we do agree that this is the primary source of not only receiving the information but receiving care, and also early identification of diseases and also prevention for some complications and further referral to hospital. But have you any also some findings that shows what people thinks beyond, of course, thinking that Ministry of Health will not be able to implement, but are there any challenges that have been identified
Actually,
by
I
your
have
research?
to emphasize that majority of participants either could not identify, didn't know what potential challenges there could be, or thought there would not be major challenges.
Good
It
to
was
hear.
15% who was worried about, as a challenge, was worried about their contribution to the system. And it was only 7% who thought the government or the Ministry of Health may not have enough capacity to implement this important project. And I want to add that in addition to having a population survey, we also had a qualitative research with health providers that included physicians and nurses working in the primary healthcare sector and in the hospital sector, and also the managers of primary care facilities, who are also very important. Particularly, the providers mentioned that it's important to receive official information through the administration of their facilities, like through directors, deputy directors, who can bring in trusted information, be the link between the policymaker, in this case the Ministry of Health, and the implementers or the provider organizations.
I say very useful because currently we're planning already to have a town hall meetings with primary healthcare, but also with hospital managers and physicians across Armenia by the end of this year to be able to implement starting from January 1st.
Dr. Nanushyan, you are a graduate of the American University of Armenia. In your opinion, how could our graduates of the Master of Public Health program or graduates of MBA program, how could they contribute to this reform, in your opinion?
First of all, when we have people already, with capacity of public health, knowledge and skills, it already helpful because you are creating an environment where people understand what we are doing or people advise us. It doesn't matter where they are working. They are working private sector, in academia or in government, but they are supportive to all those. If we are, for example, pushing for tobacco control legislation, so the pool of experts, public health experts, are supportive, and in many other areas. So first this. The second direction, I think that the students and graduates can be part of those reforms that we are currently working on. And these are not only about UHC, but under UHC we have quality reform, we have primary healthcare reform, we have not only financial but human resource reform. So I think that even while studying, they can contribute all those reforms and bring their knowledge and skills that what they learn here, they can bring and practice it with us, and we allow them to practice it. And currently we're also the third opportunity that we are currently establishing an health insurance fund, and the salary will be competitive, but we expect also the knowledgeable and experienced people will be working there because the budget will be huge one. The responsibility will be very high, and the capacity to monitor, to be also with empathy to people whom they are serving. So we expect that AUA graduates also will be interested to join to the team and to work and to lead the reform with us, because upcoming 3-4 years will be very important for the implementation of this our UHC reform, and the contribution from the alumni and also students will be huge during this challenging period. So they can be not only as a participating people, but they can also lead with us this reform, and to also have a major contribution for our people.
So I hope our students are watching this podcast and they will apply to many job opportunities, not only as stakeholders of this program will be supportive, but also will contribute as part of the health insurance fund as a single payer system that will be implemented soon. I emphasize stakeholders' contribution because in any rigorous and complicated reform, we need support from everyone. And because this is an important program for Armenia because I want to emphasize one difference. Currently, we have, for example, the state order or BEDBATVER, the basic benefit package, which is limited, but it directly purchases services for some of the vulnerable groups of our population. And when you purchase separate services for the vulnerable groups than from the other groups of the population, there is room for discrimination. But when through this program, the Ministry of Health is going to purchase insurance for including vulnerable groups, which means whether you are poor or rich, you have the same insurance coverage, the same insurance card, and the treatment when you go to health facilities is going to be the same. This is a huge support for building more equity in our healthcare system and improving not only health of the population, but also the satisfaction level of the general public because they will be healthier, they will be more protected from financial risks because of health issues. So I wanted to emphasize this for everyone because the lay audience may not know the difference.
Yes, and also if I may add that if I'm working and I contribute, I make some premiums, each month. But I should also understand that the government will subsidize the cost for my children and also the cost for my parents as an elderly. So if I pay, it doesn't mean that I will be covered alone. So my parents and kids will be also insured with health insurance. This is also important that by contributing, we also ensuring that our parents and kids also receive services, and also disabled and poor people.
Thank you very much. Before concluding our conversation, is there anything else that you would like to emphasize today?
First of all, thanks for this opportunity to talk about the reform. And I have one, maybe kind request that maybe it will be good to meet again in 1 year, in 2 years, and to see what has been done, and to make some monitoring with public health, community to see what has been right, what has been challenges, do we have done everything right, or there might be a room for any further changes. This is only one request I have.
This is a great request. So here we commit to our audience that we're going to meet again, maybe in a year, to see what happened, how did everything go. And AUA is going to help with monitoring. We will continuously collect data, understand what works better, what doesn't work, and inform the policymakers about this. We have our students who are doing internships. They are also working on their master projects at the end of the program. As part of that, they can do research projects that will help with monitoring different aspects of the health reform that you are implementing. So we're going to collaborate because the beneficiaries of this project are the citizens of Armenia.
Thank you. This is really very appreciated support, and we do need this type of support while implementing this huge reform.
Thank you, Dr. Nanushyan, for being here. It was a particular pleasure for me because, AUA students know I'm teaching comparative health systems course, and this topic is very dear to my heart because I think health and healthcare is a basic human right, and all our citizens need to have access to dignity and good health. Thank you.
Thank you.